We'd like to thank you for tuning in to this informational video where we explain the stringent rules the government has for those on Medicare, Medicaid, or regular TRICARE and who work on a federal government contract. Unfortunately, the government sees the situation as having to pay for benefits twice. Since they pay for Medicare, Medicaid, and regular TRICARE, plus the fringe benefits on a contract, they see that as double-dipping benefits for any one citizen, and they're not going to do that. So what they require is that the employee in this situation take the benefits that are earned on the federal contract, and they can't waive those benefits for any of those three. And as you may already be aware, the government doesn't exactly budge when it comes to rules about health care. They tell contractors they can provide benefits in any way they see fit, but contractors who don't provide benefits don't often get their contracts renewed. Another mandate from the government is that if an employer accepts a Medicare, Medicaid, or regular TRICARE waiver instead of providing them coverage, that employer will most likely be fined and kicked off the contract, which leads to layoffs for employees. And with that in mind, please understand that your employer has no choice but to make their coverage the primary coverage with Medicare, Medicaid, or regular TRICARE as a supplementary coverage. We also know that many of you may have objections to this or have logical arguments that seem correct about how this should be handled by the government. Unfortunately, there's not much your contractor is able to do because it's the government who pays for the benefits and your contractor who disperses them by the rules the government sets forth. And any contractor who doesn't accept that runs the risk of losing their contract and getting fined. If you're hoping for a way around this, you're probably going to be disappointed. If you decline coverage, you're going to be asked to provide proof of acceptable coverage, and if you can't do that, you're going to be automatically enrolled in the contract policy. If you present Medicare, Medicaid, or regular TRICARE as your coverage, it'll be superseded when the billing is done and still end up on your primary coverage. There's just no real way around this. However, there is some good news for TRICARE. I've been using the phrase regular TRICARE throughout the video because if you purchase a supplement to go along with TRICARE, it eliminates the government's issue and allows you to maintain that TRICARE and the rest of your package. Axim provides one as a part of a fringe spend, and if that's not something that's available, there are a number of others out on the market. Contact Axim or your company's HR to find out more about a TRICARE supplement. And that's not the only hope that's out there. There's a possibility that spousal plans, other government retirement plans, and a number of other situations may count as a waiver. But since every employer, every state, every contract and agency can be different, check with your employer as to what an acceptable waiver for coverage is. Otherwise, you may have to accept this as part of the golden rule. Uncle Sam has the gold and therefore makes the rules about your benefits. On behalf of everyone here at Axim, we'd like to thank you for watching this informational video. If you have any questions, don't hesitate to reach out to us, and we wish nothing but the best to you and your family moving forward. Thank you again for your time.